Well, we'll be working together with G7 partners to try to meet the objective that a vaccine is made available right across the world. After all, this is a global pandemic, and nobody is safe from it until everybody is safe. Now, the contribution that the UK has made, the biggest contribution, is of course the Oxford AstraZeneca vaccine, because that is available at cost right across the world, and because by its nature it's easy to distribute around the world. And now 500 million doses have been delivered of this vaccine in over 150 different countries. But we need to work together to make sure that we increase access to vaccines so that everybody ultimately can have access to a COVID vaccine, so that we can tackle this disease right around the world.
Other other nations, including G7 nations, have committed to giving some of their excess stock, or some of their stock, to other nations. Can we expect to see other plans like that from the UK, and when might we expect some detail on that?
Well, we don't have any excess doses now. As soon as we get them in from the factory, we get them out into arms, and the UK vaccination programme has very much been based on delivering vaccine as soon as it's delivered to us. So we don't have any excess doses at the moment, but absolutely we want to lean into this global effort when there is spare capacity. And of course, the single biggest thing that we can do is make sure that the Oxford AstraZeneca vaccine, which was developed with funding from the government and Oxford University and AstraZeneca, that is made available without any profit being taken, and is being manufactured in 20 different places around the world, so it can then be delivered to countries globally. So that approach means that we can get this 500 million doses out, and that obviously is a very, very significant contribution. But we don't rule out making direct contributions as and when we have excess doses, but we don't have any of those at the moment.
Ministers from some countries that will be joining you today, particularly France and Germany, are concerned about the transmission of the Indian variant or the Delta variant from the UK to their countries. What will your message to them be about that today?
Well, we do have to be careful about international travel, and the Delta variant is just one new variant, another new variant, and it shows why it's right to be careful about international travel. And countries around the world have learnt the importance of that, including us here in the UK. So that's something we look at very carefully, and I fully respect the fact that my counterparts across the world also look very carefully at that sort of at international travel, and they're right to do so.
And with that in mind, is something, vaccine passports, something that the UK will be pushing for and that you'll be discussing?
Well, ultimately, there are a number of countries around the world that said that they are definitely going to have a requirement to be vaccinated in order to travel. So we're making sure here that any Brit can see their vaccine status, and if you download the NHS app, it will tell you your vaccine status so that you can prove that for international travel. But we're some way off having an internationally agreed approach to that. It is something that we talk about and are discussing, but there's still a lot of work to do.
I'm wondering if the origins of the virus is something that you expect to be discussing amongst your colleagues today, and whether the G7, following the lead from other members, plans on putting pressure perhaps on China to that end.
Well, the single most important thing about this debate is to make sure we are better prepared with an early warning system in the future, in particular for diseases that cross the zoonotic boundary, that move from animals to humans. And we've got to make sure that we have a better early warning system in the future, and that countries then take the early action to contain an outbreak locally. And I think that's one of the big lessons from the origins of this pandemic. There will be more diseases that cross that boundary from animals to humans, and we must be better prepared as a world in the future, and that is something that that is very much on the table in the discussions this week.
I'm wondering, when you're discussing this with colleagues, whether there are any innovations or ways that other nations have dealt with the pandemic that you look across and see from Britain and think this is something in particular that we could learn from.
Yeah, there's no doubt that one of the reasons for us to get together is that we learn a lot from different countries' approaches. And in fact, throughout the whole of last year, we were meeting by Zoom weekly, and it became a bit of a became a big learning experience, because each country would say what they were doing, and others could see, and making sure that we do learn what are the best responses and best approaches is incredibly important. So this week will all be about making sure that we can, as a globe, get out of this pandemic and make sure we're better prepared for the inevitable future pandemics of the future. Sorry, I slightly garbled that. This week is all about making sure that as a world we get out of this pandemic as well as we possibly can, including with those vaccines being delivered globally, and that we are, as a globe, better prepared for the inevitable pandemics of the future, especially those diseases that cross from animals into humans, and making sure we have that early warning system that can help prevent a disease like that becoming such a major global issue as COVID-19 did.
Mm-hmm. Just coming back to the UK, for a number of days in a row, daily cases have topped 3,000. Yesterday it was 4,000.
Mm-hmm.
I'm just wondering if that's causing you to rethink plans to reopen on the 21st, and what your thoughts are about the rising cases.
Well, it's too early to say what the decision will be about the step 4 of the roadmap, which is scheduled to be no earlier than the 21st of June. Of course, I look at those data every day, and we publish them every day. The case numbers matter, but what really matters is how that translates into the number of people going to hospital, the number of people sadly dying. The vaccine breaks that link. The question is how much the link has yet been broken, because the majority of people who've ended up in hospital are not fully vaccinated. That's a good sign, if you like, because it means that the vaccine is clearly protecting people from ending up in hospital. But it also demonstrates we need to keep going with this vaccination program. And my message to everybody here in the UK and indeed around the world is that when you get the opportunity, get the jab, because you're not only protecting yourself and your loved ones, those close to you, but you're playing a part in us all getting out of this pandemic.
Okay, and experts in looking at the Olympics, experts in Japan are warning or asking the government there to rethink holding the Olympics, and warning about cases and a fifth wave, I think, there. What do you think about British athletes going to those games?
Well, I think this is a question for the Japanese government and the IOC. When it comes to the British athletes, we've offered a vaccine to British athletes who would be going to the Olympics to make sure that they are as protected as possible, and there's a rigorous testing regime in place, as there is for many of these elite sports events which have happened throughout the pandemic. One of the things we've worked really hard to do is keep elite sports going, because not least in a lockdown that was really important for people's entertainment. So we kept the football going, we've kept the rugby going, we've kept the cricket going, and we are doing everything we can to ensure that the British Olympic team are as protected as possible in order to be able to compete. Okay, thanks very much.